Cause for Hope with Dr. Larry Mitnaul and Pilar Pedraza is brought to you by Kohls Cares and Ascension via Christie in partnership with PBS Kansas Public Television.
Good evening, I'm Pilar Pedraza. We're here tonight to talk about an important health topic that affects us all, family mental health and wellness, starting with our community's children. Joining me on set is my co-host, Dr. Larry Mitnaul, a child and adolescent psychiatrist with Ascension via Christie. And we have a lot of issues to talk about that we're going to be talking about over the next few months. Before we get to those, though, a quick note about our masks. Obviously, we're not wearing them. We take them seriously.
Yes.
But you, Dr. Mitnaul, have been vaccinated?
I have, and have I had a little bit of temporary weakness to prove it, but I'm grateful for that, and so yes.
Mm-hmm. And we are socially distanced, and both of us do have our masks right here. So it's literally only off while we're in our seats. So that being said, a much more serious topic that we do have to discuss today, and that is suicide. Every year it claims the lives of an increasing number of teens, young adults, children, and just in Sedgwick County alone, but also an issue across the state. And a lot of them, they just don't realize that they're not alone. There is help available for them. And that's kind of what this program is going to be about.
And so it is important that we recognize the needs that are going on both locally and across the state in recognizing depression and how it affects people. Often it's kind of a silent illness or silent struggle that someone is feeling on the inside and maybe feeling alone, or that others aren't in the same boat or haven't had the same experiences. And so it's important to highlight this really great topic and give people a cause for hope, recognizing that there are some really great things that we can do to help improve their lives.
And that's why, with the help of a grant from Kohls Cares, Ascension via Christie is working with Wichita State University and other local partners to get the community thinking and talking about mental wellness. And that term, mental wellness, that means a lot of different things to different people, Dr. Mitnaul.
It really does. And so I think it's important that when we talk about mental wellness, that we're not just talking about the absence of a diagnosis like, major depression or anxiety, but really we're talking about the full flourishing of our mental capacities and capabilities. So the things that we think, the ability to make really great decisions, the ability to be resilient in the face of really difficult situations and circumstances and times. And so really mental wellness encompasses more than just loss. Really, it's about the flourishing of the whole person. The analogy that I sometimes make is, it would be silly for a sports fanatic to, get around with friends and talk about just the sports injuries, right? Or for musicians to get around and just talk about the broken string or the missed notes of a part of a performance. Really, what we're most interested in is the height and breadth and beauty of what sports and music have to offer. And so that's also true about our mental wellness too, that it's about helping us to be resilient, to live lives of courage and bravery in the face of difficulties, and certainly our time has experienced some of those. So that's what mental wellness can be, is a bigger conversation about how do we help one another.
And for a lot of people, it may be something as simple as taking a little bit of we've heard this term, me time.
Yes.
The bubble bath, or just going off and reading a good book. But for other folks, it does need a little bit more support.
Absolutely. And sometimes we tend to think of taking the me time. I think in the past we've framed it in such a way that it seems kind of selfish, but it turns out that investing that time in ourselves, doing things like exercise and making sure that our cardiovascular vascular lives are fed, actually that improves our emotional well-being, that improves our sense of connection to the world, but it also reduces our risks of depression and anxiety that we may carry with us. And so doing things like, the way that we keep ourselves in good nutrition and the diets that we choose for ourselves. Often these are the brain and heart healthy things that are really integral parts of building out a life that is just well. And I think when we start with that wellness for ourselves, we're able to be better for our families, our communities, and we're all better together.
So how do you know if you've moved from the I need to take a little bit of me time, maybe sadness, you've lost a loved one, you're dealing with some sadness, into something more serious like depression?
Sure, that's a great question. And because really sadness is a part of the human experience. No one makes it through without experiencing, loss or grief or just disappointment in life too. And so certainly we don't want to, pathologize what is a normal, natural human emotion. But when the sadness sticks, when the sadness stays, when the sadness just seems to cloud the way that a person is seeing their day, the way that a person is seeing their life, or when they're starting to have thoughts about, the world would be a better place without me in it, or having thoughts about self-harm. Okay, those are really significant signs that, okay, there's something going on that's beyond just prototypical sadness. There's something going on that really needs some extra care and time and attention to the task. I mean, the other big thing too that I encourage people to look for is if their world is shrinking. So, again, sadness is something that can take you out maybe for a little bit. Perhaps you need some time and you talk to a friend, or you have a great coffee and or a great night's sleep, and you're able to rebound. And maybe the pain or the hurt is still there, and that's, again, can be a very normal and natural reaction. But when it is impairing your ability to want to get up for work for a week, or it's making your world smaller and you haven't called your friend or you haven't reached out for help, if your world is starting to shrink, that too is another sign that this is a distinction between kind of depression and the sadness that we all may feel.
And a big purpose of this is not only to allow people to let people know that there are services available and what to look for, but also to normalize the conversation that this is not your fault. The person who is dealing with mental problems did not put themselves in that position. It's a health issue, just like if you broke your leg. You wouldn't tell somebody who broke a leg, come on, smile, it'll be fine.
You're absolutely right. You're absolutely right. I mean, you can't walk that off. It doesn't get better in that way. And so you're absolutely right. I think the risk can be if someone's in bed and having a hard time getting their day started or getting motivated to accomplish a task, and they're really experiencing some depression, to say, well, just pull yourself up by your bootstraps. And it turns out that really depression is a very kind of complex thing. And so sometimes when I'm describing it to teenagers or kids, I always try to have them imagine your brain like a city. So a city is organized by structure, so there are landmarks and features that define the city. The city also requires power, so there's electricity that kind of keeps things alive and turns lights on and keeps things moving. And then there's also kind of the plumbing that helps to keep the waterways going and keep people clean, healthy, sanitized, and refreshed. And so I think any time that there is, we know that structural things to the brain can affect the way that people see the world from a young age to an elderly age. We know that when it comes to the electricity of the brain, actually, which we can now measure with really great tools, that and we even talk about the brain in neurocircuitry and how it's connected. If there are difficulties there, we know that too can also lead to depression. And then also in terms of the plumbing and the chemistry, those things too are really important. The hormones that our brains kind of produce or lack can also contribute to that as well. And so it's not simply it's not a personal failing, but really a biological thing.
Yeah. And a little bit of transparency here. My family, several of us have struggled historically with depression. The signs and symptoms that an episode may be coming on kind of vary from person to person, but there are some things that kind of carry through for everybody. What might those be?
Yeah, so certainly if someone is having thoughts of suicide, so that's a significant symptom. If they're losing interest in things that they previously really enjoyed, if they're carrying around a ton of guilty feelings that there really is no reason for and are weighing down their day, they can have significant changes in their activity level as well. So I think when you take those those things together, if they've been continuing for more than a week or two, those things are really significant. I think this would be a great time to turn over to Dr. Jessica Provines. We were able to have a really great conversation. She's at Wichita State University, and she has some really great ideas talking about a program to help people be resilient and to understand depression better. Dr. Provines, welcome. I'm really grateful that we get a chance to talk today about the incredible work that you're doing. And perhaps to get us started, I'd really like to hear a lot about your background and part of your role really with Wichita State University.
Well, thank you, Dr. Mitnaul, for having me. I'm just as excited to be here talking with you today. My background is as a clinical psychologist. I'm a licensed provider in Kansas and have been working with particularly college student mental health since I completed my graduate training at Wichita State University. And I have continued to stay there and serve now as our Assistant Vice President of Wellness, which is really the university's commitment to approaching student wellness from a holistic perspective. It's combining student health, mental health, and campus recreation all in one so we can take care of the mind, body, spirit.
God, what a great orientation to really caring for the whole person and the whole mind and their emotional lives. I really like how you express that. You know, I'm really interested in hearing about Suspenders for Hope. I mean, you wear it, and but not only that, I think we got a chance to talk a little bit before this about your heart for the mission too. So can you share with us a little bit more about that?
Absolutely. You know, the Suspenders for Hope is all about making mental health cool and talking about mental health cool because face it, it is. You know, we all have mental health. You know, my journey at Wichita State started as a transfer student, and it didn't go well. We know that transitions in people's lives are very challenging and make you more prone to have mental health, you know, struggles. And that was when I experienced my first depressive episode, was as a sophomore at Wichita State. And at the time, I did not know about what services were available to me as a student because we didn't talk about it as much back when I was a student. And so I've made it my mission to make sure that every student, when they come onto campus, they know exactly where they can get help when they start to struggle. And then with the Suspenders for Hope, we wanted to take it further. And we got a grant from SAMHSA to help us do more mental health awareness and suicide prevention training on campus. The Suspenders are really a symbol of hope and supportive mental health communities. It's all about ending the stigma and wearing your suspenders with pride, showing that you support mental health and that you are a mental health advocate. I put a lot of my heart and soul into this project because I too, like so many out there, am a suicide loss survivor. And when you experience a loss like that, it's so traumatic. I mean, it changes you forever. It's devastating, and you can never bring back those loved ones. You know, the guilt and the shame is real. And at first I didn't want to talk about it because I thought that if others knew that they might blame me, like sometimes I blame myself. But I know that suicide is no one's fault, not even the person who dies by suicide.
That's right.
And so by talking about it, it's really helped me heal and helped, inspire others to get help and know that they're not alone. And so while we can't bring our loved ones back, I'm pouring all my love into this program to help prevent this from anyone else having to experience it.
That's so great. What a beautiful vision, and even describing the walk that I think others have experienced, and certainly I've had the experience too of having that type of loss, and you're not sure how you're able to share that, or if other people have had similar experiences too. But by bringing that out in the open, as you are doing, it sounds like there's a chance for healing and for all of us to kind of grow and be better knitted together.
Yeah, the more I talk about it, the more people come forward and share with me that they too have experienced this, and it just creates a connection. And we need to bring it out of the darkness and out of the silence, so we know that we don't have to suffer alone.
Great. What are some of your goals around this really incredible program, and where do you begin in building such a major initiative?
So the Suspenders for Hope program started with a federal grant, And we were trying to, implement evidence-based suicide prevention trainings on our campus, as well as an awareness campaign. And then when the funding for the grant ran out, we realized that we didn't have the engagement in our training that we had hoped, but our suspenders had really caught on and students were wearing them. And so we thought, we can develop our own training and we can tie it to the suspenders. And once that happened, we increased the participation in our training by 426% in the first 2 years.
Wow.
And now we have departments that are mandating the training for all of their students and all of their faculty and staff. They're doing Suspender Fridays, wearing the shirts on Mental Health Awareness Days, and wearing them on Friday as a sign of solidarity around mental health. And so it just has really grown from there. We wanted the program to be more than just a training. And we also wanted it to be more than just an awareness campaign. And so the program is a strategic, comprehensive approach to changing cultures, changing cultures, awareness, and support towards mental health.
Okay.
The first step of the program, of course, is the Suspenders for Hope awareness campaign, which we really focus a lot on social media, and we want people to get involved, take selfies in their suspenders, and share their stories of hope and recovery and resiliency, being vulnerable with others, and sharing those stories online and using the hashtag. And then we also do the training as well. There's an hour and a half preventing suicide training that we have made available online, so it can be done on demand to anyone who wants to access it from our website. And then there's an advocate program that those who want to take it up a notch and become an advocate, there's certain steps that they can do to become a We Support You advocate. And then we're really excited about our newest addition, which is a easy-to-use mental wellness curriculum, which is actually a set of cards that just have 5 to 10 minute exercises that anyone teaching a class in history or economics could easily infuse just a few mental wellness moments into their course content. Okay. So we can really sneak that spinach in the smoothie,
right.
As opposed to just a one-off training. We really want to make this broader than that.
That's so wonderful. So it's both accessible, it's something, short and doesn't have to be really disruptive, and it's portable. So you can really kind of offer that in many locations. And it sounds like there isn't anyone who couldn't benefit from these resources. Can you talk about the significance too of the suspenders and the T-shirts? They look really great, and I know that they're more than a symbol. And you've kind of mentioned that their role in helping to get some visual around the mission that you've begun. So yeah, can you say more about that?
Yeah, they are a symbol of pride. They really help to reduce stigma. When you wear your suspenders, you're letting others know that you support mental health. And it really is our vision that one day they are a universal symbol for supportive mental health communities, and that they're very recognizable. When you see the suspenders, you're going to know that it's okay to not be okay, that I should talk openly about my mental health, and getting help and accessing the resources that are available to me is something that is cool to do and not something that you should be ashamed of doing.
I like that. I love that. So what has been the response to the campaign on campus? What is some of the feedback that you're getting from faculty, from staff, but also from the students?
Mm-hmm. The response has been huge. Our students are so concerned about their mental health right now, especially with the pandemic.
Yes.
For a normal, traditional college-age student, they're experiencing more of an impact on their mental health right now than from the actual virus. Mm-hmm. The loss in their family, the economic impacts that it's having, the isolation and the disconnection from their peers. And so they are our biggest champions at Wichita State for the importance of mental health. This generation is letting the generations that have come before know that it's time to end mental health stigma, and to say, hey, I go to therapy, I take medication, and there's nothing wrong with that.
Yes, good. And that's a strength based perspective too, that we're helping people to feel empowered in telling their story, and that this is just one of the facets of being a human and living a full life.
Yes, the Suspenders is all about strengths. It's about changing the conversation around mental health and suicide to one of hope, recovery, and resiliency.
Oh, amazing. So my understanding is that the Kohls Cares grant has been helpful too in spreading this to a couple local Wichita high schools, kind of in support too with Ascension via Christie. So can you talk about that phase of the development?
Yes, this has just been a dream come true, really. You know, this last September, which is Suicide Prevention Awareness Month, my team, we said, how can we take this community-wide? How can we bring this thing that we're doing at Wichita State and reach more people so we can help more people?
Yeah.
And so we launched our website, and you know, I spoke to some different local healthcare groups, and that happened to get us connected with Ascension via Christie, who had recently received this wonderful Kohls Care grant to help do exactly what we're doing, you know, in the community. And they learned about what we're doing. We learned about what they were wanting to do to help reduce stigma and reduce suicides in children and families. And we thought, what a wonderful opportunity for us to partner together, two pillars in our community to really help make a difference. And so we are very excited to be launching it at two local high schools. Bishop Carroll and Cape and Mount Carmel are the first two that are involved in the program, but we hope to expand it even more past there. And you know, they're planning to take it to their entire student body, to all of their instructors, to get this important training and bring this campaign, you know, to the high school students. And we know that they're struggling right now, and they need it.
Good. And if people are looking for an opportunity to get connected, to be a part of this, or to learn more and get trained, where would they go?
So they can go to the viachristie.org/Kohls-Cares website. But they can go to that website, and that will give them instructions on how they can take the training for free. We wanted to, with this partnership with Ascension, we wanted to make the 1.5-hour preventing suicide training available to our whole community at no charge. So you can go on there, you can take the training. If you want to go to the suspendersforhope.com website, you can order yourself a suspender shirt, and then you can get involved in, you know, the local movement on letting people know that it's okay to not be okay, and that you are a supporter of mental health.
Fantastic. Dr. Provines, it's been such an honor for me to have your time, and you've been just so gracious with your time in sharing this important message. Is there anything else as we wrap up that you think it'd be really helpful for people to know, or maybe take away, that you might have to share?
I just want you know, people to know that it's human to struggle. And we've all been struggling right now, particularly with the pandemic. Our routines have been upended. You know, we don't have anything to look forward to, it feels like. And so we're all struggling. And I just want folks to know that that is okay, and that treatment works, help works. You know, there's a lot of focus on, you know, the increase in suicide deaths. And while every suicide death is important, I like to talk about how 10.5 million people every year seriously consider suicide and struggle with thoughts of suicide. There are some estimates that say almost half of a college student body has thoughts of suicide at some point. And while every loss to suicide is important, less than 0.5% of those 10.5 million people die by suicide. So what that tells us is that overwhelmingly the majority of people find a way to get through that crisis. They reach out to a hotline, they talk to a friend, they get involved in a sport, they start, you know, picking up a walking habit, you know, or they go to treatment and they take medication. They do something, because treatment works. And that's what I want to let people know, that there is hope. You can get through this crisis. Don't give up. You're not alone. A lot of people have gone through this, and you can get through it too.
Dr. Provines, that is the most hopeful message. I feel impassioned and empowered to walk alongside you and help promote this. So thank you so much for that and for giving such a hopeful kind of perspective on what we need to do and how we can help people in need who may be struggling, whether it's within our own families, whether it's people who are watching this as well. So thank you for your time and for sharing this message of hope.
I really appreciate the opportunity, and I'm so glad I got to meet you.
Likewise. Likewise.
Some really fascinating information there and very useful. If somebody's interested in this training, how do they get started?
So the great thing is it's available on the Via Christi website, which we'll put up the link to, and it's really, really easy. You go to the website, it has some links that allow you to just get started in a step-by-step fashion, and it's very user-friendly. So that's, if someone wants to tune in, that's the way that they're able to really get access to that free resource.
And everybody always wants, okay, so what are things that I can do? Obviously, taking this training is one thing that you can do. But if you think that you have somebody in your life, family, friend, coworker, who seems to be struggling, what are some things that you can do to help out?
Sure. That is such a great question. I think reaching out and just letting someone know that you care about them, that you're thinking of them, and extending yourself is one of the primary ways. Often, I think depression especially is the type of thing that many people are suffering in silence when they do feel it, and sometimes they might feel a sense of, well, I can't let anyone know or kind of share part of this journey with me, and so being proactive in, if you haven't heard from someone or you haven't seen someone in a while or maybe haven't checked in, all right, this might be a good time to write a letter, send a text, drop off a care package to help them to recognize that you're thinking about them too. And then from that and from those conversations, sometimes we can get to the heart of things and asking, is there anything else that you need, or is there a way that I can help support you?
Okay, we're about out of time, so very quickly, one final takeaway. What do you think is the most important thing for folks to take away from this program?
I think the biggest thing to take away is that we have really great treatments, and I think the better that we get at being confident in both recognizing it and talking about this doesn't have to be something that hides in the darkness, but we're better when it's shared in the light. So we have really great treatments, the treatments do work, and that in itself is cause for hope.
And once again, here is that website if you are looking for help, if you want to try out this program, lots of great tools and resources there. We will be back next month with what is now a monthly program, and next month we'll be talking about bullying, so be sure to tune in. Thank you so much.
This program was made possible by Kohls Cares Cause Merchandise Program, supporting the health of families nationwide, including local hospital partnerships like this one with Ascension Via Christi. More information at kohls.com/cares.